Patients will soon be able to use the NHS app to opt for private hospital treatment in an effort to cut waiting times, according to a report. The NHS waiting list for routine treatment stands more than 7 million and is predicted to keep rising until next spring. Both of the main political parties are relying on more people choosing to pay for private care to bring down waiting times and free up the NHS. A report in the Times said, though, that only 28 NHS hospitals currently allow patients to manage appointments via the app, although this is expected to be expanded, which is when the private hospital option will be offered for the first time. A Whitehall source cited by the newspaper said there is definitely scope for that. The NHS app is increasingly well used. There is already some functionality where patients can directly book, and we are looking to modernise those booking capabilities and update the options in the app. A statement though for the Department of Health and Social Care said, cutting waiting lists is one of the government's top 5 priorities, with the NHS app playing a vital role in giving patients greater control over their own care and support elective care recovery. We have already started to implement the Effective Recovery Task Force work, and full plan will soon be published, outline how we can go even further to unlock the independent sector to get patients treated more quickly and reduce waiting lists. Prime Minister Rishi Sunak is expected to confirm the plans in the coming weeks, the Times said. So this is it, is it? Rather than, of course, building more hospitals or maybe even hiring more doctors, it's down to us to actually pay extra to go private, when of course we shouldn't really be doing that when we pay our national insurance. I mean, what's the point in us paying it when presumably we'd go on the app to book our appointment, you then see the waiting list is like 200 million names long and you have to wait for 253 years before the next appointment is available on the NHS. Or you could get one private for a certain amount, which is more than likely going to be ridiculous, isn't it? And only have to wait about 37 days or something like that. Maybe this could even be the start of the privatisation of the NHS, because let's face it, if more and more people book private, then presumably more doctors will move from the NHS working to private to keep up with the demand, thereby making the waiting list longer and causing even more of a problem in the first place. Because let's face it, whilst there is still a cap from what I've heard in training UK doctors, then the problem just isn't going to get solved, is it? And just a thought, maybe there could be such a backlog because there isn't enough doctors or hospitals to actually deal with the ever-increasing demand, is there? So rather than putting the emphasis on us to deal with it, they should be building more hospitals and hiring more doctors and remove that cap. But of course this isn't the only thing we've heard, is it? Because apparently some doctors want to start using advanced AI, such as apps like ChatGPT, which admittedly may cut down the times in writing any such reports, but I don't think that'll be a good thing in the long run, because presumably then if an app is doing all the work, the doctor isn't, and therefore who knows, the app might make some mistakes which the doctor wouldn't be aware of and can make people's treatment a whole lot worse, couldn't it? So whilst this skip the queue option in the NHS app might be good for some people, I don't think it'll end up being good for the majority. And that, of course, does make me wonder if it was actually inspired by Full and Holly. But anyway, if you think that's bad, then wait until you have a look at this video with something that will be even more worse than speed cameras, which will also fine you for a lot more than just speeding. Anyway, subscribe for more and I'll see you in the next one.